speakers and so good afternoon, everyone, and welcome to a very exciting and informative panel that we have put together on behalf of Winchester Climate Solutions Week here in 2022. This panel will be addressing the topics protecting your health in a changing climate. My name is Greg Sawicki. I'm a pediatric pulmonologist at Boston Children's Hospital and also a member of the Winchester Board of Health. And I want to thank Ruth Trimarchi, the chair of the Board of Health, as well as Ken Pruitt, the town sustainability director, for their help in organizing and establishing this interesting and informative panel. We're going to have four great speakers today talking to us about varying topics related to the impact of climate change and health. And as we get through each of these presentations, we will be introducing each speaker individually. This is a webinar over Zoom, so any questions from our public that is viewing us today can be sent in through the Q&A option at the bottom of the Zoom screen. And at the end of each of the four presentations, we will have a moderated panel discussion around these important topics. So without further ado, I have the pleasure of introducing our first speaker, Ms. Jennifer Murphy, who is the health director for the town of Winchester. She has been the director of public health for our town for over 18 years. And prior to that, worked at the Massachusetts Department of Public Health in the Division of Community Sanitation and Childhood Lead Poisoning Prevention Program. She has done incredible work for our town through various iterations as the director of public health. She has a master's of public health with a concentration in environmental health from Boston University, and has been a leader in public health efforts throughout our town for many years. Jen, I'll turn it over to you.
Thank you. And I guess I'll kick things off here, talking about climate change and public health. It's good to be with everyone today discussing this important topic. Let's see. Oh, there we go. So I figured we'd start off with a slide. This is from the director of the Climate Change and Health Center at Boston University. Climate change is the greatest threat to our health and well-being. And what's interesting to note that Boston University started this center for climate change and health and the interconnection of both within the School of Public Health in 2020. So clearly the issue is very pressing and very important. And so this slide really shows you all of the impacts from climate change. Climate change that we're speaking of is rising temperatures, weather extremes, and rising sea levels. And the human health impacts of those vary widely. And it's interesting to note how those three climate changes that we are experiencing right now and will continue to change unless we take extreme measures really result in some varied impacts to us, ones that we are seeing right here in Winchester, which I will get into in more depth. Now, first, I want to recognize that there are a whole host of town officials and organizations that deal with an emergency response to human health, and especially human health impacts resulting from emergencies like natural disasters and extreme weather situations. And so it's fair of me to recognize who those people are, who those agencies are within the town, ranging from our fire chief, who is actually our emergency management director, Chief Rick Tustin, our police department, our DPW, health department, as well as the hospital, all play a role in planning for and carrying out the response to emergencies. So I just want to make note of that is a team and collaborative approach for any natural disasters or extreme weather events that we experience locally. But for the health department, the areas that I wanted to focus on today are extreme heat, vector-borne diseases, waterborne diseases, and mental health. And again, I acknowledge that, the slide to the right does have a whole host of impacts that we can experience. And as a community, state, and country, we need to look more closely at those and the preventative and resiliency measures that we can all take. But today I just want to focus on what we see, what I observe, and what we're experiencing and responding to here in Winchester. Now, our first most pressing issue I think that we can acknowledge is extreme heat or high heat events. And obviously, as we experience, even just from this past summer, we are experiencing more frequency, more of a heat wave duration, and our heat wave season is actually increasing. And the expansion of that heat wave season is really driving some of the things that I have been observing over the past few years here locally. And so extreme heat events are expected to become more common, more severe, and longer lasting as our climate changes. And who's at most risk from these changes? Well, our vulnerable populations, including our elderly, infants and children, pregnant women, those who work out of doors, such as manual laborers, athletes who practice outdoors, and folks who are in the low income, who are least prepared to deal with extreme heat situations. Now, that's not to say that people who are in relatively good health can't be impacted as well. As we know, the longer duration we experience high heat, the harder it is for our bodies to cool themselves and to recover from extreme heat conditions. So it really can potentially impact everyone. And what are the risks to our human health? Well, it can exacerbate any of the current illnesses we're already experiencing and underlying conditions. It can trigger heat stress conditions such as heat stroke and heat exhaustion. But we can also potentially see increased hospital admissions for heat-related illness. For example, increases in cardiovascular events, respiratory disorders. And there is a connection between mental health and changes in our climate, and we can discuss that a little bit later on briefly. But what is our response to these efforts? Well, we do have a heat strategy that was devised with the help of Ken Pruitt and the Climate Action Committee. And that was devised to plan, what can we do? How can we respond to high heat events? And so we have many players, as I mentioned previously, involved. And we provide for cooling centers in extreme heat days. The library and the Jenks Center during normal business hours do provide for cooling centers, so anyone can go to those two buildings and cool off. And we do promote that widely during heat events so that anyone can take advantage of that. The Senior Center, Jenks Senior Center, is also very good at reaching out to vulnerable folks to see if they are okay, to do check-ins with them and see what their needs are, and even provide them with transportation to get to one of our cooling centers. The Senior Center is also great at connecting people with air conditioning units who may not have them. So I strongly suggest that seniors in town connect with the Jenks Center ahead of time and plan for these high heat events so that you can stay cool in your home or elsewhere if needed. We are providing a whole host of preparedness resources. I know that Ken Pruitt has done a fabulous job preparing some robust materials on our website, winchester.us, under the sustainability department. And so I suggest that people do connect with our town webpage to access those preparedness resources. There is as I mentioned, there is a written heat response strategy. So I do suggest people take a look at that as well for other strategies and prevention measures that are laid out in that document. And I believe that's accessible online as well. Ken has done a fabulous job outreaching to the public, hosting public events to try to explain all of the details in that document as well. And I believe it's actually available online through WinCamp too. So what is happening locally as a result of this extended warm season that we are experiencing? We're seeing the distribution of diseases, some that we have never been affected by, starting to move further north from the south. Now, some of these that I mentioned at the top, like Zika, chikungunya, and even dengue, we're not experiencing those types of diseases on a consistent level yet, and hopefully not in the near future. However, as the species of mosquitoes new ones are coming north from the south, they do have the potential to bring diseases that we don't regularly experience here in Massachusetts. Over the past 20 years, we have seen 7 new species of mosquitoes, not all of them pathogen or disease carrying or able to transmit to humans. However, the potential is there. And as long as our climate continues in the direction that it's going, the potential for that increases. So right now in Winchester, what we are most concerned about is West Nile virus. So with the increasing heat and extreme weather, for example, increases in rainfall, that can provide a better habitat for the proliferation of mosquitoes, therefore increasing the risk to humans. So West Nile virus is something we're concerned about, but we do have a plan to prevent the mosquito population from proliferating. And we take actions every year, actually. We apply larvicide, which is a naturally occurring bacteria, to all of our catch basins. There are about 3,500 of them in town. And we do contract with a mosquito control program to do that for us. So that apply larvicide to catch basins and apply larvicide to select wetlands in town that are the ideal habitat for the species of mosquitoes in town that we have that carry West Nile virus or have the potential to carry West Nile virus and can transmit to humans. So those actions are taken preventatively every year. We also do during the prime mosquito season is to conduct surveillance. The Massachusetts Department of Public Health and our mosquito district do that for us. And they do sampling of mosquito pools for the virus and identify when the virus is present so that we know when to communicate to the public when it's time to really focus in and take preventative measures to protect yourself from being bitten. Now, there are a whole host of mosquitoes in town that are biting, but don't always carry disease. But the Culex pipiens, what the species they were most concerned about, certainly would be impacted by the weather in the direction that it's going, the heat, and the extended season. So they would have the ability to cycle through more frequently, and we would see the population exploding if we didn't take these preventative measures, conduct surveillance, and when needed, and as a measure of last resort, conduct spraying. And that spraying would either be targeted or townwide. However, again, that is a measure of absolute last resort when we have the West Nile virus diagnosed in humans. So when we start to see cases like that, we take our cue from DPH on whether or not we would actually spray in the community. Now, another vector-borne disease that we are concerned about in time, or vector-borne diseases we are concerned about, are those that ticks carry. And there are many. We're concerned primarily about Lyme disease in town. However, we are seeing an increase of anaplasmosis and babesiosis, and a few others actually. Ticks are a bit more tricky, I want to say, because the prevention, there are not a lot of prevention measures that we can take other than personal protection. That really is our best defense. Don't get bitten in the first place. But if you're an avid outdoorsman, that might be a little bit tricky, but you just have to know the prevention measures to take for yourself, whether it be clothing, whether it be DEET, to stay safe. So preventing the bite in the first place is the way to go. But again, ticks are now having a longer season. And so what we're seeing is the population explode of ticks. So we really need to focus in on personal protection. And the health department tries to do ample risk communication. We also provide for tick identification. If residents in town find a tick on themselves or their pets, they have the ability at very low cost, thanks to grants from the Winchester Hospital, to have the tick tested to see if in fact that tick was carrying a pathogen. What other vector-borne diseases are potentially, or other vectors are impacted by a longer, warmer season? Certainly mice and rats is something that we have heard quite a lot about over the past 5 years. Our winters have been milder, which allow for mice and rats to reproduce a lot more. Their population has exploded, I would say, in the past 5 years that I can recall. We certainly get a lot more calls to the health department about mice and rats. So what are some of the things that the health department is doing? Certainly communication, risk education to the public. We have some materials online on the health department webpage that tell homeowners how to best protect their property and their home and to keep mice and rats out of their property. What we also do is pre-demolition pest control surveys. That is when a private property is looking to demolish a building on their property, we require them to hire someone to do a survey for pests because we don't want that building to come down and have all the mice and rats scattered to the neighboring properties. So we do education around that, and that is a requirement when someone's looking to demolish their home. Also, when we're conducting restaurant inspections, one of the things we look for are rodents. How well are restaurants keeping rodents out of the food service industry? Because obviously we're concerned about things like hantavirus and other pathogens from mice and rats. So that's very important. So that's a routine part of every inspection we do for any of our restaurants in town. The health department also responds to nuisance complaints. When someone calls and says that they have spotted rats either in their property or in any other area in the neighborhood. So what we would do is respond to that by going out to try to find out the source of what may be drawing the rats or the mice to that location. And oftentimes what we see is people have a food source, right? So rats and mice definitely want to go where there's food, water, and shelter. So if you don't have those three things, then the likelihood of you drawing rats is very low. So we try to do education around that, but oftentimes we will have to become an enforcement arm for the regulations, and the nuisance complaint will be followed up on in that way. In other words, we will have to give people a timeline by which to comply to remove that food, water, or shelter from their property so that it is not an attraction for the rodents. So really, I think the goal for people to know is that we really need to branch out on our education efforts. That's always our best line of defense for the population. And you can go and get more education, as I mentioned, on the health department webpage there. One thing I want to note is oftentimes people are quick to, bait for or lay out poison for mice and rodents, and that's not exactly a great first line of defense. And in fact, we try to encourage people when they hire a pest control operator to really focus in on the three things that I mentioned, removing those from the area first: the food, water, and the shelter. If they don't have a habitable place to stay, they're not going to stick around. So you have to be mindful of baiting or laying out poisons because predators eat the rodents, and then we have a problem up the food chain that we don't want to have. Another impact that we're seeing because of warmer summer season are waterborne diseases. So the increase of high heat days leads to an increase of extreme weather and increased high heat days lead to an increase of potential flooding and runoff. And I see this impacted at Wedge Pond quite a bit. The rec department does operate the beach at Wedge Pond, or we did up until about 2 years ago. And the health department would be responsible for testing the water for bacteria and keeping an eye on any cyanobacteria blooms. So when you have flooding conditions, all of that water, if you have a short time with a lot of water, all the runoff goes into our waterways, and catch basins lead into our waterways as well, bringing with it any kind of nutrient or fertilizer from people's lawns into a waterway such as Wedge Pond. And so we have a really high rate of nutrient loading into Wedge Pond that can elevate the likelihood of cyanobacteria blooms, also commonly known as blue-green algae. This is when we see this is actual picture I took at Wedge Pond. It almost looks like a pea soup condition, but this is a blue-green algae bloom. It's actually cyanobacteria. It's not truly an algae, but it's something that can impact our health if we were to have contact with it, or if we were to especially ingest it, because the cells can have the potential to contain toxins. So if humans or pets ingest the cyanobacteria and those cells contain toxins, there could be serious consequences to health. But certainly, even just entering the water, you could potentially develop a rash. So there are consequences that way. And so what I have noticed over time, since I've been here, since it's 2004, I've noticed more blooms in Wedge Pond, actually. And we have treated the blooms on a targeted basis over the years. But it was around 2010, 2011, where we started to see an increase of the blooms. And they have actually just increased since that time, to the point now where we actually were treating the pond preventatively so that we could continue to enjoy it as a natural resource. And so prior to COVID, when the pond was operated regularly, we would treat the pond 3 times in one summer with copper sulfate, just to keep the blooms at bay and to keep it safe for swimming, boating, and fishing. And so we really need to consider as a town what the long-term strategy is going to be. If climate change continues in the direction it's going, where we have an extended warm season and we continue our nutrient loading of the pond, and there's very little dilution, there's no real fresh water added to Wedge Pond at a rate that would dilute the nutrients sufficiently to keep the blooms at bay, the question becomes, what are we going to do to keep this valuable resource in the future? I think we're treating it for the short term to enjoy it, but what is our long-term goal? And those are actually conversations taking place right now within the town and town officials to try to come up with a robust study and a set of recommendations so that we can address blooms in Wedge Pond. And this strategy would probably pertain to other water bodies like Winter Pond. They experience the same issues. And obviously Mystic Lake, that's run by DCR, but they experience the same issues as well, with frequent blooms that have been increasing over the past decade. And then we also have the resulting elevated bacteria with short bursts of intense rain that contributes to the bacteria. So I think we have a lot to do locally in terms of prevention. We need to educate folks around lawn care and nutrient loading to their lawns. And so that'll be obviously some efforts that we need to bolster over time as well. And so the last thing I just want to hit on is mental health, because I know that there are related, anxiety responses associated with natural disasters and even the talk of climate change. I know my kids, this is a very important topic for them and something that they worry about, to the point where I think it causes a bit of stress for their generation. And so we do see a mental health response to all that we are experiencing related to climate change. And so just so folks are reminded, we do have a lot of information that we put out about mental health through the Winchester Coalition for a Safer Community. Everyone in town should be receiving a pamphlet shortly in the mail, which will list a whole host of resources that people can tap into if they themselves or someone in the family are experiencing a mental health related issue. So stay tuned for that coming in the mail for every resident. You can always reach out to the Winchester Coalition for more resources as well. But I think it's fair to note that there is a link between climate change and mental health concerns. And yeah, so here's just a slide about what you can do. On the left there, Greg, am I running out of time? I'm sorry.
Yeah, we can. That's fine, Jen. I think we can I think we can sort of put that up again, I think, at the end too, because I think there's a lot of great information here too.
Okay, perfect. Thank you.
Right.
That probably wraps that up. Yeah.
Great. So thanks, Jen, so much for that great overview about, the different threats that the town is facing, both at an environmental level and a health level. And I think with that, we'll turn it over to our next speaker, who is coming at it from the healthcare system and the healthcare system's operations perspective. And that's Dr. Rick Weiner, who is the president of Winchester Hospital and has been at Winchester Hospital for over 36 years. He's a vascular and general surgeon, but has been serving in hospital administration for quite some time, and is also a clinical professor of surgery at Tufts Medical School. Dr. Weiner, I'll pass the floor over to you.
All right, thank you very much. Let me go ahead and share my screen. All right, can you see the slides?
Yes.
Great. All right, thanks for the opportunity to address this topic here. My focus is actually pretty limited and will be pretty brief. But I was charged with trying to share a perspective coming from the hospital. In particular, how does the increased temperature, really hot days, how does that affect the use of the hospital and the emergency department? It was an interesting topic, and I actually did a little bit of data mining to try to get some data to back up what we perceived as an experience here. And not to repeat what Jen said so thoroughly. And by the way, the relationship with Jen in the hospital has been really a tremendous one. She does a great job, really appreciative. So the conditions that are caused by extreme heat include heat rash, which is also called prickly heat or malaria, heat cramps, heat exhaustion, and classic heat stroke, which is really named severe non-exertional hyperthermia. You could have exertional hyperthermia, as she mentioned, with athletes working out outside, but the classic heat stroke is with non-exertional hyperthermia. Other conditions are aggravated by extreme heat, including autoimmune conditions, which is very interesting. MS, lupus, rheumatoid arthritis, to name a few. Patients with these conditions seem to do worse on really hot days. The respiratory illnesses that Greg deals with frequently, although COPD is probably a lot less common at Boston Children's Hospital. Asthma, allergies, migraines seem to be affected a lot. Of course, heart disease and arthritis, not just the rheumatoid arthritis, but also osteoarthritis, kind of wear and tear that we all get. So I went back over a couple of months in 2021. I picked the two hottest months, which are July and August. And then I looked at the temperature every day. Thank goodness for Google. You can go back and look at what the peak temperature has been in the town of Winchester on any given day in history that has been recorded. And the orange line here on the bottom is what the temperatures have been. And you can see they're all pretty warm, right? Up in the 80s range, but some are warmer than others. And I picked the 6 days that actually had temperatures of 90 degrees or greater. I then looked at how many visits we had to the emergency department, whether they were walk-in patients, patients arriving by car or by ambulance, all comers, for all conditions. I didn't try to sort out the ones that are known to be related to heat, but this includes behavioral health patients too. And as you can see, there's a lot of variation in the number of visits. But in general, when I did the averaging out of those 6 days compared to the other days in these 2 months, actually it was 12 days when the temperature was at least 90 degrees, that the average number of visits to the emergency department were 7 to 8% higher on those days. This variation is complicated to deal with as a hospital in terms of staffing, et cetera. And with the behavioral health crisis that we've been having, we will often have in excess of 10 patients waiting in the hospital for an inpatient psychiatric bed. We are not licensed to hospitalize patients primarily with a psychiatric diagnosis, although patients are hospitalized for other conditions that have a comorbidity of a significant behavioral health diagnosis. But patients that need inpatient psychiatric care have to wait in our emergency room until a bed opens up. And that's a whole nother crisis. We're very short in beds due to the staffing challenges and just the increase in behavioral health issues in the Commonwealth. But it was interesting that there did seem to be a correlation, despite all the variation, that a significant increase in visits when the days were 90 degrees or hotter. And that is all I have.
Thanks, Dr. Weiner. That's really interesting data, and sort of we can talk a little bit about that later on. Just thinking about the impact that different climate events may have. I'd be also curious on the flip side, in terms of large storms and other impacts that they may have on the hospital and hospital operations. And I think locally we see all of these things. We'll turn our attention now to again further effects of the environment on potential health, and we'll turn it over to Miss Elisa Jazan. I hope I pronounced your name properly. She is a PhD candidate in civil and environmental engineering at Tufts University, currently focusing in environmental health. Her research focuses on the detrimental effects of background exposure to pesticides and health-related concerns related to organic pollutants. We're really excited to have her as part of this panel. Locally, she's also on the board of the Winchester Farmers Market and has been a member of Winchester Town Meeting for many years. So without further ado, I'll turn it over to Elisa.
Hi, let me see. All right, how does that look?
Great.
I can't tell what it looks like from here. My name is Elisa Jazan, and like he just said, I research exposure to chemicals in the environment at Tufts. So I'm going to talk about pesticides. Sorry, my camera's in my way of my slides. Pesticides, GMO systems, and climate change. And before I want to give a little overview of GMOs first, and then I'll talk a little bit about my research and try to tie it all into climate change. When I talk about GMO crops, I'm talking about subsidy crops, commodity crops, such as wheat, corn, soybeans, and cotton. The original GMO crops were Roundup resistant crops in the mid 1990s. Most people are aware of that. And the argument was they would reduce pesticide use, and they did for a few years. And then due to weed resistance and Roundup resistant weeds, pesticide use has been increasing almost exponentially since then, herbicides. So a few herbicides that were in declining use due to their toxicity profile and drift and volatility in favor of Roundup, which actually has a lower toxicity profile, have been coming back into use. And the one I want to focus on is called 2,4-D. So 2,4-D is the 5th most used herbicide in agriculture, and it's the most used one in residences. You find it in like your lawn and turf products, that sort of thing. A little bit of background on it. It's actually the first commercially available pesticide in the 1940s. It was also a major component of Agent Orange in the 1960s. There were 2 defoliants in that, and one of them has been banned, but 2,4-D was not. Due to the weed resistance of glyphosate or Roundup, and like exclusive and intensive use of it, they are now trying to incorporate other herbicide resistant into their GMO crops. And so in 2014, the first one was approved. As you can see here, in 2015, it was listed as 2,4-D was listed as a possible human carcinogen. And then this is kind of my focus. In 2019, soybeans were approved that are triply resistant to glyphosate, glufosinate, and 2,4-D. Because of this, the USDA predicts that 2,4-D use will increase 100 to 600%. And this is all recent. In fact, these soybeans took 20% of the market share in 2020. As you can see here, this is from the USGS. 2,4-D use has increased 72% between 2005 and 2019. That's before these crops were on the market, or 50 million pounds, which is a lot. So should we be concerned? Are we being exposed to it? It's not just in agriculture. So NHANES, which is the CDC biomonitoring program that is representative of US population, found in 2009, 2010, 65%, it was detectable in 65% of the US population, but by 2013, 2014, it was detectable in 76% of people. And down here, if you can see, in 81% of children. Once again, before these crops were approved. These other papers, one was in a daycare, 85%. They found it in 85% of children and adults. I find this one interesting. In Iowa, they were analyzing deaths in homes, and regardless if they were rural or not, they found 2,4-D in 95% of homes. 2,4-D does break down in sunlight, but if it's not exposed to sunlight or air, it does not, like in your dust, which is considered a chemical sink. As you can see here, the CDC admits itself, human health effects from 2,4-D from low environmental exposures are unknown. So you would think, since it's been approved since the 1940s, there would be a lot of data on it. However, there are a lot of cancer endpoint human studies. These light blue ones are human studies, mostly non-Hodgkin's lymphoma from Agent Orange studies. I want to point out here, my interest is endocrine studies. Of these 5 studies, 2 were acute poisonings 50 years ago. And then the other ones are just use or never use. And there is no studies with endocrine endpoints using biomonitoring data. And then I'll just point out right here, there are no developmental studies. This is from the CDC's own lit review in 2020. So there is a huge gap in knowledge. I have also found that this is just sort of how our chemical policy works, but I think it's worse for herbicides and pesticides, that most of the data we have is from the chemical manufacturers themselves. I think this quote is very indicative of how US chemical policy works. This is from a journal that is known to be industry friendly, but it is a peer-reviewed journal that no studies indicate there is no basis for concern. And so it is unlikely to pose a threat. I personally find that a little backwards. Just because there's no studies does not mean it's safe, but that's how it works here in the US. Then to tie it all into climate change. So that's a little bit my focus. I'm coming at that with different angles. I have some preliminary data showing some correlation between sex hormones and exposure, background exposure to 2,4-D using CDC data that's already published. So GMO systems and climate change. So the main issue, the other chemical most used is fertilizer, synthetic fertilizer on these GMO systems. Nitrogen gives us greenhouse gases in the fields. It is a petroleum byproduct. I don't know if you've heard the news, but the war in Ukraine, one of the main imports hit was fertilizer. And actually 30% of all global greenhouse gas emissions come from agriculture. I will also point out that these GMO crops, actually soybeans and corn especially, are really mostly used for animal feed. And I think it is common knowledge that meat products are really bad for the environment. So in conclusion, we are asking the wrong questions. I don't think it's whether the products are safe to eat. They are probably functionally equivalent. That is not my focus. However, the GMO agricultural system itself is not sustainable and is damaging our environment and is harmful to our health. And then I'll just end it with my favorite quote from Rachel Carson, which I do contend that we have put poisonous and biologically potent chemicals indiscriminately in the hands of people largely or wholly ignorant of their potential for harm. And 50 years later, I still think this holds true. Thank you.
Thank you, Elisa, for that provocative set of data, and good luck with your work. And I think in terms of disseminating this message, I think it's important for people to hear it, both here locally and then more broadly. And we'll have some time in a little bit to, I think, ask a few more questions about that. But I'll turn it over to our final speaker, and it's going to provide us a little bit more of a perspective at the state level, because I think we can talk about, and what we started talking about was a lot of things at the local or town level, but I think obviously we know we don't live in a vacuum. We live in a state, in a country, in a world that's struggling with the effects of climate change on health. And so we're excited to have Cheryl Sbarra here with us. She is the Executive Director and Senior Staff Attorney for the Massachusetts Association of Health Boards, providing policy guidance and assistance to 351 local boards of health in Massachusetts. She's assisting boards of health and other municipal officials in developing and enacting and enforcing local regulations and bylaws, served on multiple different commissions for the state around public health, and is a member of the Massachusetts Public Health Association's Policy Committee. Cheryl, I'll turn it over to you.
Thank you. Let me just hopefully share my screen. Okay, can everyone see this? Great. Yeah. Great. Thanks very much for having me. I've learned a lot. I've been working with Jennifer Murphy for a very long time, and I echo what Dr. Weiner said. She is just a splendid health director, and I can say from my statewide experience, she's probably one of the best in the Commonwealth of Massachusetts. Jen, don't let your head get too big, but it's true. So what all lawyers do is, I just want to make clear that this information is being provided for legal educational purposes only. The only attorneys that can give legal advice to the town are town council. So that's just my disclaimer. So everyone's already talked about this, but I like the definition of climate change that comes from some of my colleagues at the Network for Public Health Law, and they define it as long-term shifts in temperature and weather patterns that are mainly caused by human activities, especially the burning of fossil fuels. So we're really looking at global warming and sea level rise. And when we look at these things, you know, you have to be cognizant of the fact that there is a growing body of research that really looks at the disproportionate and unequal risks that climate change has had and will continue to have on communities that are most vulnerable. Jen mentioned this at the beginning. They're most vulnerable because they are not able to anticipate, cope with, and recover from the adverse impacts, as well as some other populations are. And the EPA recently did a report that quantified the disproportionate risks to these vulnerable populations. And they looked at income levels, race and ethnicity, educational attainment, and age. And this is what the EPA has concluded in their report. And I would really recommend that folks look at this, because this is from our own federal government. And when they looked at these factors, they found that Black and African Americans were 40% more likely to live in areas with the highest increases in mortality rates due to high temperatures. They also found that the same population, Black and African Americans, are 34% more likely to live in areas with projected increases in childhood asthma due to air pollution caused by climate-driven changes. Hispanic and Latino individuals are 43% more likely to live in the highest projected labor hour losses areas due to extreme temperatures as well. And the same population are 50% more likely to live in coastal areas with the highest projected increases in high tide flooding during traffic delays. American Indian and Alaska Natives are 40% more likely to live in areas where the highest percentage of land is anticipated to be inundated because of sea level rises. The same population are 34% more likely to live in areas with the highest projected labor hour losses because of weather exposed industries and high temperatures. And Asian individuals are also 23% more likely to live in coastal areas that experience traffic delays due to high tide flooding. Low income or no high school diploma individuals, again, you see the discrepancies here. 25% more likely to lose labor hours due to extreme temperatures, 15% more likely to live in areas with childhood asthma diagnoses due to air pollution. And interestingly, they did not find a statistically different percentage of those over 65 that would live in areas which had projected increase in climate change impacts. However, I would just put a caveat there with the work that Jen and the Winchester Health Department are doing with elders and heat. And I can't imagine that is not a significant issue and challenge for our elderly population in Massachusetts and in Winchester. So what is the intersection between public health law and climate change? I think Jen and some of the previous speakers made it clear that public health and climate change are clearly connected. And in public health law, when we're looking at policy changes, we are constantly doing a balancing test between the government's obligation pursuant to its police powers to protect the health, safety, and welfare of its residents and individual rights. This is a constant exercise that we perform on a daily basis. When do your individual rights succeed? When do they have to be limited because of the need to protect public health, safety, and welfare? It's the conundrum that we live with in public health and what public health law tries to resolve in the best way that we can. So it's interesting when you look at some of the more significant cases that have looked at the duty to protect public health and climate change impacts. The first case, and it was a very controversial case with lots of dissenting opinions from the United States Supreme Court. And it was a really tragic case in the state of Wisconsin where the court actually held that a child who had been severely beaten over a period of years by his father and suffered from permanent brain damage and was institutionalized. That was what the case was about. And the court held that even though the state knew about this abuse, the harm did not occur when the child was in the state's custody. It happened when the child was in the private custody of his father. The court concluded that the harm was not caused by the state, but it was caused by the father, and that the state did not have an obligation to protect that child when the child was in the private custody of its father. The next case that, so that's a case that really underscores what the state's role is in looking at public health issues. And in that case, the court said the father did this, not the state. We would contrast that with a case that's more on point in the discussion that we're having this afternoon, Juliana versus the United States. And this was a case from the Ninth Circuit that is a very recent case. And it's a case where the plaintiffs sued the United States, including President Trump, and all the way down through a lot of federal agencies. And they sued because they said they were denied their right to due process because they had a right to a climate system that was capable of sustaining human life. And that the climate change issues that we are dealing with now are threatening that threatening the system capable of sustaining human life. What the court ruled, although the court was extremely sympathetic to the plaintiff's claims and actually embraced the plaintiff's claims, they felt that they did not have any jurisdiction to issue an order to the president and to his administration and agencies to develop a plan to phase out fossil fuels emissions and draw down excessive atmospheric CO2. They just felt that they did not have, because of the separation of government, that they didn't have the jurisdiction to do that. But they did claim, they did empathize and agree that catastrophic climate change will cause human deaths, shorten human lifespans, result in widespread damage to property, threaten human food sources, and dramatically alter the planet's ecosystem. As the previous speaker just spoke to that issue. The court actually examined the evidence that was presented by lots of experts that testified on behalf of the plaintiffs, and really looked at the atmospheric carbon dioxide rise that we've seen for almost 3 million years. They looked at the thousands of years of concentration that was between 180 and 280 parts per billion. Now it's over 410 parts per million and climbing. And half of that increase occurred in the last 40 years. This is all written in the opinion of the court. And they mentioned and underscored that back in 1965 in the Johnson administration, that administration warned that fossil fuel emissions threatened climate and temperatures and sea levels. And this is a quote from the case, which it speaks for itself. The government affirmatively promotes fossil fuel use in a host of ways, including beneficial tax provisions, permits for imports and exports, subsidies for domestic and overseas project, and leases for fuel extraction on federal land. So the court was extremely cognizant of and took note of the plaintiff's allegations, but did not find that their solution in a court order was something that they had the legal authority to issue. So Now we have another case in Massachusetts where Attorney General Healy sued Exxon. There are about 20 of these cases pending in the United States right now, and the premise of these cases is pretty similar in that it's suing industries, especially here the fossil fuel industry, claiming that they intentionally misled the public on climate change to a devastating effect. And I would just mention here, having watched Dope Sick and having been involved on a very personal level with many of the cases brought against the tobacco industry, I see it, and I don't think it doesn't take a rocket scientist to see the similarities in these types of litigation. It's a relatively new litigation strategy for the fossil fuel industry, but it's not new when we look at the history. And Professor Sokol stated that to hold the industry to account for its organized systematic climate disinformation campaign is really the legal strategy being utilized now. In Massachusetts, the Attorney General invoked the Consumer Protection Act and has claimed in its lawsuit that Exxon has misrepresented and failed to disclose material facts relative to the systematic climate change risks to Massachusetts investors. They've misrepresented the alleged environmental benefits of using its products, failed to disclose risks of climate change caused by fossil fuel products, and promoted false and misleading greenwashing campaigns to consumers. Exxon filed a motion to dismiss this case in Superior Court, and they lost that motion to dismiss. So the case is still pending in Massachusetts in Suffolk Superior Court. There are some other legal strategies that can be used to decrease climate change, and we see this in our own town, and we see it across the state, looking at increasing walkability, encouraging net zero energy buildings, advocating for more green space, encouraging more public transportation, and zoning, which is an area of the law and that I don't think a lot of people think about when they think about zoning. Most people think about zoning as, where do you place buildings and stores and in industry and neighborhoods, where if you actually look at what the goal of zoning is, it's the same as the goal of public health. It's to protect the health, safety, and welfare of residents. And it comes from the same enabling legislation where public health gets its police powers. Again, it's not just to make a town look pretty. It's actually to protect health, safety, and welfare. So built environment issues, climate change mitigation issues are perfectly within the legal authority of the zoning law, and also looking at mixed use zoning, which I know Winchester has been doing. So built environment strategies can help decrease climate change, and we're working on that. We also have some laws that are actually they're looked to nationally, and one is looking at health impact assessments and incorporating climate change policies in those assessments. And in Massachusetts, we have a law that includes a healthy transportation compact that requires these assessments to determine the effect of transportation projects on public health and vulnerable populations. It's written right into the law, and we have a policy from the Department of Transportation where we have a directive that establishes health-related guidelines. And I would say also, and it's not on my slides and it should be, that when we're looking at city and town charters obviously in Winchester's case, there is a move underfoot when we're looking at charters to either implicitly or explicitly look at public health and incorporate public health issues, which clearly include climate change issues, when you're looking at at amending a charter, which is done periodically. The last thing I will talk about is the new law that was signed by the governor last month. It's called an act driving clean energy and offshore wind. I believe that says, I can't see because my, never mind, it's not important. But there are three main areas that the law addresses. And one is renewable energy, and it provides funding for offshore wind energy and electricity grid improvements. I'm not going to read all of this, you can read it. It removes wood burning power plants from our renewable portfolio standards so that these plants can't count toward renewable energy goals anymore. And it incentivizes solar energy by doubling the kilowatts that homeowners can include in metering. New funds will be available to companies who are working on new clean power technologies, and it creates new funds to create a clean energy equity workforce, which will assist current and former workers in the fossil fuel industry. So, you know, at a time where Massachusetts has money coming in through ARPA funds and some new funds that are coming into health departments through public health excellence grants. This is a really important initiative, and we're lucky that the governor has signed this and the legislature proposed it. It's not perfect, but it's a step in the right direction. The second section of the law talks about the transportation sector emissions, and these are clearly the largest source of emissions. And what this law does is it attempts to electrify transportation by making electric vehicles more affordable, especially for low-income individuals. And it does require that all new, not existing, but all new vehicle sales to be zero emission by 2035, which is something that was done in California as well. And it also creates a charging infrastructure deployment fund to help support the goals so that there are more venues for electric vehicles to be charged. It also permits fossil fuel bans in municipalities. And again, these would just be relative to new construction, and they would be done through zoning bylaws. And it would exempt healthcare facilities and scientific labs. And right now, it would only apply currently to a pilot program that Massachusetts has created, which includes 10 municipalities. And though the municipalities, in order to be in the pilot program, have to meet the state affordable housing requirement. That was one section that the governor wasn't thrilled with, but he didn't veto it because of it. He said that there was too much good in the law, and while he didn't like it, he understood why it was in there, and I certainly understand why it's in there, and I think it's a good idea. These are the municipalities in the pilot program, and that, I think, is it. Here is my contact information, and I will turn it back over to Greg.
Thanks, Cheryl, and thanks to all our panelists for a really engaging hour and conversation on what I think is a very challenging topic, clearly at the intersection of science, research, public health, healthcare delivery, policy, and law. So we can see why it is there's so much to potentially talk about and think about. And I think we'll just take a few minutes for some questions for our panelists. And I think I'll just take the prerogative to ask. I think we've heard all this, and I think awareness and education is absolutely key. But I maybe ask each of you to think and reflect on what's one thing or one area that you think that individuals in the public in our town should be doing or changing or thinking about right now in their own individual lives to sort of work on improving the potential adverse impacts on health when it comes to climate change or other environmental challenges? And then maybe what's one thing that the town leadership, government, or local government should potentially be focusing on in terms of helping our population at large? So I'll pose that question sort of to all of you, and so anyone can feel free to take it on. Rick.
I would say from an individual basis, it would be to not vote for anybody who's a climate change denier. I know you don't want to get political, but I mean, these battles are hard enough to fight if you believe in climate change. If you don't, it's impossible.
Jen, Elisa, Cheryl, any other comments from?
I actually was thinking along the same lines. Get involved in local government. I mean, I remember a state senator saying to me once that, you know, when she got a call from a constituent, you know, if she got 2 calls, it was like a nuclear war. I mean, they don't hear from us enough, and they work for us. You know, we pay them to work for us. And letting them know what you think is really important, and we don't do it enough. And that's what I would say: get involved and let your voice be heard.
Jen?
Yeah, to tag on what Cheryl said, I think there are 2 things. One is people need to know how to build resiliency for them and their family, and utilizing the materials that we put on the town website is one way to do that. And number 2, making it known to, you know, your legislators as well as your local town officials that these things are a priority. Things that perhaps I mentioned, Wedge Pond, we want to value that as a natural resource, and we don't want to let it turn into a swamp. You know, number 2, you know, we need to have a plan and staff to deal with the increasing mice and rat population. I mean, those things aren't necessarily priorities. They're definitely things we're tackling, but to keep the pressure on those types of things that we're seeing increase, but could potentially help bring us harm. So to really push those to the forefront to our politicians and to keep it funded and a priority.
Elisa.
I'll talk a little less overview global, since Jen Murphy also brought this up in her presentation, and it's one of the things that's really my pet peeve, talking about our waterways and how we have to shut them down because of bacterial growth, and then people complain. Because I know when my kids were little, I donated a lot to that splash park on Wedge Pond, and then people would be like, oh, but it's closed, so I never go. And I want to be, but it's your own fault, because the vast majority, at least in my neighborhood, pay for lawn care services. No one's paying attention, and it's all the nutrient runoff and whatnot. And we are actually responsible for that. And I wish we could make that message more clear. And that's just in addition to the health effects that I am now researching.
Thanks. And I see there was a question from one of our audience members that Cheryl, you seem to be answering, but you can answer live too about the court decisions, particularly around the Juliana decision.
Well, the first question was about what the AG's office was claiming for damages in the case against Exxon. And because it's a consumer protection case, if the state wins that case, they would be entitled to treble damages, but I'm not sure what the exact dollar amount is that they are claiming, but I will follow up and get back to you. I don't have the complaint in front of me, and my guess is that they don't have a dollar amount right now established, but I can get back to you. And is the Juliana decision being appealed to the Supreme Court? I don't believe it is. I checked on Westlaw yesterday, and there did not appear to be an appeal pending. So I do not believe it is being appealed to the Supreme Court.
Thank you. And again, thank you to all our panelists for this really engaging set of presentations and really educating the public. And I think It's important that this information be shared, not just among the attendees that were here today, but to be made available, and that will be the case. So all the slide decks from today's presentation will be available on the Sustainability Department website moving forward, and there'll be a recording sent to WinCam and made available at WinCam and the town website. I'm sure all of the panelists would be happy to take any questions offline or over email related to any of their presentations, and I really do want to thank everyone for their time and attention today.
Thank you.